Let's move on and talk about tendons and ligaments. Tendons are cord-like structures that attach muscle to bone. Tendons have several functions. First and most importantly, they transmit the force of a muscular contraction to the bone. They facilitate joint and limb movements, and they resist high tensile forces with a limited amount of elongation or elasticity. What are the characteristics of those tendons? Well, as we learned when we studied general connective tissue, they are comprised of dense regular connective tissue. Remember that dense regular CT has a predominance of fibrillar components over ground substance and cells. Dense regular CT is characterized by parallel arrays of the fibrillar network within the matrix. The cellular elements are aligned between those fiber bundles. So as in all dense regular CT, the characteristics of this tissue is really determined by the matrix. In tendons, the dry mass is mainly fibrillar, being about 86% collagen with a small amount of elastin and a little bit of proteoglycans and various inorganic compounds as listed here. Nearly all of the collagen is type 1, and that means tendons have a lot of tensile strength. Remember, type 1 is the one that you see in things like organ capsules, bone, dermis of the skin. It's the type of collagen that you see when you need a lot of tensile strength. Type 1 collagen has the largest diameter fibrils and fibers, and therefore is the strongest. Depending on the location, there may be varied amounts of collagen type 3, 4, 5, 9, and 10. The cell population that lives within tendons is a type of fibroblast, and we're going to call them tendinocytes. Tendinocytes, like all fibroblasts, make and maintain and turn over that matrix and can proliferate in injury to facilitate healing. The blood supply is located within specific connective tissue coverings in the tendon, and it's not really very great. It's a relatively poorly vascularized tissue, which means healing can be a little bit slow, as anyone who's ever had an injury to a tendon can attest to. So how is a tendon put together? Like muscles, tendons have those connective tissue coverings and are divided into fascicles. So the outermost covering that ensheathes the entire tendon is called the epitendon, and within the tendon there are fascicles and subfascicles and so on, and those are covered by something called endotenin. So all the fascicle coverings we're going to call endotenin, whether they are primary, secondary, or tertiary, and you don't have to worry about those, all right? Remember that the cell type is a tendinocyte, makes all of the ECM that makes up the mass of this tendon, and that's a type of fibroblast. What does it look like? In this diagram, or this picture I should say, you can see at the top the thicker connective tissue covering the epitendon. Then you can see the bulk of the tendon underneath that, which has tendinocytes stretched out in the direction of all of the collagen. The collagen is the very light pink. You cannot see individual collagen fibrils here. You need an EM to see fibrils. What you're seeing is fibers. So within that tendon, it's divided into these little subgroups, and those are tendon fascicles. And between those, you see the ENT label. Those are the endotendons. So they have little connective tissue areas that divide it into fascicles. At higher mag, you can see the tendinocyte nuclei as well as elements that are located inside the endotenin. So you see some endotenin, and then you see a blood vessel embedded in that connective tissue. And everything between all of those other elements is the collagen. Ligaments are anchoring bands of connective tissue that help to suspend or support other structures. There's a lot of different kinds of ligaments: visceral ligaments, peritoneal ligaments, fetal remnant ligaments, skin or dermal attached ligaments, and even a periodontal ligament, without which I might add that you never could bother with braces, because the periodontal ligament is what's responsible for the movement of teeth when you have braces. Just a little sidelight there. But the one we're really interested in is the skeletal ligament, also called the articular ligament. These are connective tissue bands that bind bone to bone and must be able to withstand great pressure and have a degree of elasticity. The following material on ligaments is only going to talk about skeletal or articular ligaments. So what do ligaments do? They function to restrict the joint movement by stabilizing the joints and keeping everything in proper alignment. However, they do allow for a greater degree of stretch. In other words, they have some elasticity to them. And because they are not so strictly linearly aligned as tendons, they allow for limited movement in several directions. They also have some mechanoreceptors and free nerve endings that help with joint proprioception. Now, skeletal ligaments are very similar to tendons in several respects. First of all, they are comprised of dense regular connective tissue, so they have all of the characteristics of dense regular connective tissue. They are populated by fibroblasts, and I've seen literature that calls them ligamentocytes, but we're just going to call them fibroblasts here, make life easy. And those fibroblasts make, maintain, and turn over that extracellular matrix in which they live, and they can proliferate to facilitate healing after injury. But again, because this is a tissue that's poorly vascularized, that injury response and healing is a bit slow. However, ligaments are quite different from tendons in some other important respects. First of all, they have a lot less tensile strength than a tendon. Remember, tendon had mostly type 1, which is the very strong tensile strength collagen. Well, ligaments have both a lower percentage of collagen than tendons and smaller diameter collagen fibers. That means they're going to be not resisting the tensile forces quite as well. However, they are more viscoelastic than tendons. They have more ability to stretch. They have both a higher percentage of elastin as well as proteoglycans and even more water. Therefore, they have a little bit more stretchability. Collagen fibers of ligaments are not organized in the same strictly linear fashion as tendons. Some of the fibers are non-parallel. This allows ligaments to withstand forces applied in several directions rather than just in one direction as tendons do. And the fibroblasts that populate ligaments are more rounded, according to some sources, than tendinocytes. Really, in reality, most of the tissues that I've seen, they look pretty much the same, but this is in the literature, so it's here in your lecture material. So how is a ligament put together? Well, really, this is almost a carbon copy of what we saw for tendons. Just like muscles and tendons, ligaments have connective tissue coverings and are divided into fascicles. Same motif of organization that we saw before. Some ligaments have an outer-like capsule covering called reticular membrane, or the epiligament, which is the term that I would prefer. And interiorly, they are in fact divided into fascicles. However, ligament fascicles are very difficult to distinguish histologically, and you won't be held responsible for doing that. You just should know that they're there, and it's organized in the same way as a tendon is. Ligaments have a very prominent wavy pattern, or what they call crimp, to them when you look at them histologically, and in the EM too. And this actually is thought to have a biomechanical role. So when you put a load on this ligament, it gradually uncrimps and straightens out, which allows for some of the elongation up to about 10 or 15% without going into failure. In other words, without damage, like a tear or a complete rupture. Some ligaments have a very large amount of elastin in their extracellular matrix. These are called elastic ligaments because they can have up to like 20% of the fibrillar content be elastic. A good example here is the ligament flava of the spine. Elastic ligaments have increased stretch and recoil ability, even compared to other ligaments of the articular type. So in the example I gave of the ligament flava, this elasticity assists in maintaining your upright posture, and then after flexion, it allows the vertebral column to recover without misalignment. So the image here is an elastic stained ligament of this elastic ligament type, and you can see the abundance of elastic fibers that are just permeating this entire matrix here, and really allowing for this high degree of elasticity, so that's stretch and recoil ability. So that's all the content we have for this unit, and we'll see you in lab.